Hello, everybody. We're just waiting for a couple more people. We're waiting for one of our speakers, and then we're gonna get started. I hope everyone is well. I hope it's sunny where you are. The sun has decided to show its beautiful face where we are, and there's beautiful clouds. So I'm actually going to start off with, a poll that you have all seen on your screen as we're waiting for everybody to come in and settle in. So what do you think is the answer? Is this true or false? The proportion of female researchers in artificial intelligence was higher in the 90s than it is now. Do you think it's true or do you think it's false? We will reveal that later on. What do you think it is? And why is this debate still happening in the 21st century? Jennifer, what do you think?
I definitely think there's more women representation overall in tech and in healthcare. I've even seen that shift in the course of my career, which is awesome. I don't think we're yet at gender parity, but I feel like it's something that can happen in my career and in my lifetime. There's a huge amount of emphasis on gender parity and a lot of people working towards that in allyship, which is just wonderful to be experiencing that and to see that trajectory just, over the past decade.
Amazing. What do you think, Danielle?
Oh boy. No, I think it has started to change, which is amazing. And yeah, we definitely still have a way to go, that's for sure. But one of the kind of experiences that comes to mind was when I was in a meeting for women management of a consulting firm, and we had one kind of male partner with us to experience the event, and about 40 women in the room. And he said, "This is the first time I've ever felt really like an outsider. I've never been in a room only full of women." I just looked at him and I said, "That's what every day is for me." So that was only a couple of years ago, and it is starting to shift, but and I can't wait. And I would like to do everything I can to make sure we have so many more women in tech. So let's do that.
Awesome. Lorena. Oh, there we go. We've got the poll. So actually, this was something that I found out from Women in Global Health, which is an organization that helps women across the globe to get into kind of STEM careers. And it is actually shocking that female researchers in AI was actually higher in the 90s than it is now. So what is the reason why we're regressing? And so that this is basically what we're going to be discussing today. I don't know where Ryan is. Maybe we should give another 2 minutes. And maybe Lorena, if you can, what do you think from
I don't know,
perspective?
It's not the first time. Like, all the computers at the beginning, when they were like the cards, all that were done by women. And even the debugging and all of that. And suddenly at some point it switched, because I don't know what, but it seems like, oh, it's so cool now to do this. So now like women go to do other things, and then we get all the men there. But I feel like it's not a isolated issue, and it's not the first time that happened, that something is done, a new field the women should start to doing, but then for whatever reason we get let's see, we move from there. But I didn't know that from AI specifically, but the computer is another, or math, like doing all the math when it was all manual, because there was no calculator as well. So it's curious to know that. I really don't know why though. But,
Let's take a moment and think about, you know, how far we've come. Like, it was only the 70s where women were not even allowed to, I mean, I think it's what, in 1993 or one, where women were allowed to vote in Switzerland, which is really backwards. I mean, that's probably a little bit overstated, but, you know, we've come far. We've got further to go, but we've come really far. And that's what's exciting. And this is why we're here having this discussion today. So as we're waiting, and so we'll just maybe start because I'm quite conscious of the time. So thank you so much for everyone joining us today. Sophia, you're there. Cool. So hello and welcome to our second webinar in our BioTalent Social live panel discussion. Today, we will be talking about gender bias in data and technology. We will have a 45-minute discussion followed by a 15-minute Q&A and a half an hour networking session for those who want to continue the discussion further. So my name is Luchelle Mendez. I am a senior consultant in data science, and I'm passionate about driving change for equality in health technology, addressing the gender gap to empower people and ensure everyone's voices are heard. I am going to be your host and chair for this webinar. A report by McKinsey stated that the growing use of artificial intelligence in sensitive areas, including for hiring, criminal justice, and healthcare, has stirred a debate about biases and fairness. Yet human decision-making in these other domains can be massively flawed, shaped by individual and societal biases that are often unconscious. Will AI's decisions be less biased than human ones, or will AI propagate the issues? In order to critically analyze the unfair biases that can become baked in and scaled by AI systems, we need to involve all genders in every part of the developmental cycle. And yet, according to Nesta's research in 2019, only 13.83% of all AI researchers are women. So our aim, I've just got a message from Ryan, but Lucy, if you can deal with that, sorry. So our aim today is to help drive change by having a meaningful discussion on how to create diverse workplaces, discuss experiences, reflect on progress, but also highlight where there is room for improvement. We want to make the discussion as engaging as possible. So if you have any questions, any comments, I know Sophia is going to be asking us very thought-provoking questions. Please use the panel on the sidebar to write your questions or your comments. So, and to get you started, here's another poll question for you. So gender bias in medical diagnosis can cause significant issues for women compared to men. What is the main impact? Later diagnosis, underdiagnosis of conditions, overdiagnosis of conditions, overprescription of medication, less effective treatment, or more adverse reactions to treatment. Awesome. So lastly, before we kick things off, please note that this is being recorded and will be uploaded on our YouTube channel, which you can also access, and you can access our previous webinars. So amazing. And I will pause here for a second because I think we're waiting for Ryan and he's having a bit of difficulty. Lucy, is everything okay? Okay. He said he's going to be a little bit, oh, there you are, Ryan.
So sorry, I got the time zones wrong.
Where are you at the moment? In Chicago?
I'm not, I'm in Las Vegas, and I had this on my phone for 11 o'clock local. I'm completely sorry and embarrassed.
That's absolutely fine. Welcome. We're very grateful and glad that you're here.
Thank you.
So I've just starting to, well, you've come at the best time, to be honest. I'm literally just about to introduce you all. So without further ado, I'd like to introduce our fabulous panel who are currently in Zurich, Boston, and Las Vegas. We'd love to know more about our audience too. So please tell us where you're located across the world in the chat box. So now over to our panel. If you could introduce yourself, your role, your experience, a key passion, either in gender equality or general life. So let's start with the lovely Danielle Raleigh, who is the CEO of Ancora AI.
Okay. Firstly, it's such a pleasure to be here. I love talking about this, and I think it's just so important to have the conversations to be able to move the needle. So thank you for putting this together. But yes, I'm born in Boston. I'm the CEO and CTO of a health tech startup called Ancora AI. We're in Zurich and Zadar, and today Boston, just to keep things moving. My background, I graduated with a degree in information systems, a specialty in healthcare IT, and a double major in finance. So started off on that tech side, mostly in a consulting type of role. So I worked at Deloitte for a little bit in their tech practice, did some SAP implementations because of the finance background, worked with hospitals and public sector, implementing various reporting solutions, and then joined a more boutique consultancy to work on pharmaceutical clients, and focused really there on business intelligence implementations and kind of various functions. So from medical to pricing to commercial. And that took me from Boston, LA, Zurich. So definitely happy to share any of the experience and the different geographies. And then I guess with my last sort of role, I was our head of social analytics, where we were investigating natural language processing to be able to understand healthcare conversations happening in public domain and private when available. And that sort of led me to starting a company that looked at using NLP to help democratize some healthcare text, which is a little tricky to get to. So that whole theme is around clinical trial participation and helping people access trials. My passion, definitely on diversity and making sure we have that diversity, particularly focused in tech because that affects me most dearly. But I think that diversity of opinions, of experiences and backgrounds is critical for us to build the future. And that's what we're doing directly in technology. So I'm so passionate about helping everyone get to tech and overcoming those hurdles. So happy to chat about any of those topics.
Excellent. Thank you so much, Danielle. Next, we have Ryan Gregory Mastro, partner at IBM. If you could introduce yourself, please.
Thanks, Lachelle. Thanks, everybody. My name is Ryan Mastro. I am a partner at IBM. I also have spent the entirety of my career working in healthcare and life sciences. I have a PhD in molecular biology and neurobiology. I moved pretty much immediately after my PhD into life sciences, drug development and commercialization. The work I did in that space was largely analytics driven. I like to joke that I was doing data science before they were calling it data science. After many years working in life sciences and drug development and discovery and commercialization, I moved to the payer side of healthcare. I've worked at CVS Health, I've worked at United Healthcare. I now work at IBM as a partner in data analytics in the healthcare sector. And I also have been really passionate about the importance of diversity and inclusion in technology, in data and analytics for a variety of reasons. But for me, most importantly, I have found and have firsthand experience in seeing what can go wrong when analytics and advanced analytics services are developed and deployed into the marketplace with a very gender biased development team. And I think it's a really important time to be having this conversation. So thank you so much, Luchelle, and all the panelists for including me.
Amazing. Thank you so much, Ryan.
Of course.
Then we have Jennifer Cubino, Chief Operating Officer at BC Platforms.
Everyone, thank you so much. Chief Operating Officer at BC Platforms. We are a data science and software company with expertise in genomics and integration of clinical data. I've been at BC Platforms 2.5 years now. I am an American transplant in Zurich, still struggling with the painful use of the word "the" in German. Never quite works out as good as I would like it to. Prior to this, I was at IQVIA for 15 years. My expertise is in drug development end-to-end and integration of technology into the clinical development process. So thank you for the invitation today. In terms of my passion, there's a couple to mention. First is just representation matters. So similarly, as has been shared, how do we have truly a representative team? And further, how do we instill curiosity and complementarity in that team? And so being able to take teams that are from very diverse backgrounds and helping them understand with their complementarity how to really rise together and perform phenomenally well because they understand how to leverage each other's differences. And so I keep that focus with my team actually on a daily basis. It's very core to how I lead and how I drive results in the organization.
Amazing. Thank you so much. And next we have Sophia Barovka, CEO of Ason Technologies. If you could introduce yourself.
Thank you, Lucia. Yeah, so my name is Sophia, and I have a PhD in theoretical particle physics. I was also working in research for several years, predicting kind of what's happening at CERN in Geneva, this bigger laboratory. After that, I moved to industry and founded Ason Technologies. It's a medical technology startup where we have two products that basically should make the life of a doctor easy, in particular with ultrasound, which is technology that I love. And which is helping kind of getting more data and combining it with the intuition that the doctor has, but also adding more data points that could give an independent viewpoint to things. And this is maybe something that I'm passionate about, to have rational point of views, to work to have as much as possible a statistic mindset, and what I also like, what is important to me is kind of the integrity that, I don't know, developing everyone in my team, but also for myself, towards a state where we are where we are the best versions of ourselves, because we're real with what we believe and what we want to do, and who we are.
Amazing. Thank you so much, Sophia. And lastly, we have Lorena Pantano, last but not least, who is the head of computational biology at Next RNA. So if you want to introduce yourself, please.
Yeah, thank you. And thank you for organizing this. It's amazing to be here and with all the other panelists and everybody else, just to discuss a very regular topic nowadays. So my background is in computational biology. I have spent 13 years developing statistical models and visualization of biological data. And I in general can do to interpretation. So actually one of my core skills that I always try to keep working is in try to be unbiased in the way we interpret data. So I did the PhD in Barcelona and I moved here. So I have been 7 years here, and I'm very, I like a lot all the science going on in this city. So it's good to be in the top of the wave on computational biology. My passions I would say that you can reduce it to try to give same opportunity to everybody. It could be gender in some cases. It could be the computational biology field itself that is now getting a little bit more weight in terms of where you can go working in this field. So for me, it doesn't matter who or where you come from. You should have an opportunity to work in the field you want, and you should have an opportunity to be in whatever different kind of positions according to what you think you like and you are good at. So wherever I am, I try to focus on that and work on that in any way possible.
Amazing. That is our lovely panelist. Thank you so much for that. So I am very conscious of time, so I am going to kickstart and go for it. So let's start the discussion with drug discovery and clinical trials. So 30 years ago, the US Congress passed the National Institute of Health Revitalization Act, which mandated the inclusion of women in government research. And yet today, women are still grossly misrepresented. This misrepresentation has allowed for women reporting more adverse events and health risks, such as acute liver failure as a result of certain drug exposure, as well as withdrawal of 8 out of 10 prescription drugs between the years 1997 and 2001 due to safety concerns within women. So according to you, how much work do we still have to do to ensure women are represented in all phases of drug development? And how can new advances in data-driven research, such as biomarkers, as well as innovations in clinical trials, mitigate these risks further? I will start the conversation with Jennifer, as you are in the forefront of clinical trials.
Yeah, so if I look across the span of my career in clinical research, I began in 2002, 2003, starting off actually on an IRB for Tufts, and then further as a CRA monitoring clinical trials, managing them, et cetera. So over the course of that time, I have seen an increased representation in women and an increased focus in understanding of gender differences in clinical research. I don't believe, based on the data that I've seen and the direct experience on the clinical trials, that we have the gender representation in most indications that mirror the actual patient population. But I do see that there's a lot of emphasis on recruitment and engagement of women. I will also add that there's a huge focus on recruitment of patients that are truly representative of the population being studied, whether there's different ethnic differences as well, but trying to get us close to that patient population. There's all sorts of reasons why people may or may not choose to participate in clinical trials. And interestingly, this was the topic of my master's thesis and something that I kept coming back to throughout my career, which is how do you effectively engage people in this and help answer their questions in a way that's pertinent to them? And the absolute best way to do that is to have direct to patient conversations. What I've seen in the last 5 years is that the large pharma are really leading the way with patient engagement and having direct patient feedback and discussions about what's meaningful to patients with those particular diseases. MS is a great example. So there's panels now where patients are advising drug companies about outcomes that are really important to them. And MS is a disease that very much affects more women than men. And so by these mostly women communicating to the pharma companies about how they would measure success in their disease being controlled, it's really changed how the clinical trials are being written, the patient burden in that, and in bringing that voice in. So I see openness in the industry to have the right conversations, but we need to continue on that openness and continue on that listening in the industry. I don't think we've arrived. We're just aware we should.
I was going to ask Sophia, actually, you know, one of the reasons why women were historically excluded from clinical trials phases 1 and 2 was because of the controversy of the thalidomide tragedy in pregnant women. What do you think, Sophia? You know, how do you feel about women being less represented in clinical trials, and how do you feel about them increasing in number?
So generally, I think that there are regulations that kind of state how, if you want to make medication available to a certain population, that this population needs to be represented. And I think that the regulations are getting tighter on this topic. So it's it's something that needs to be done by regulation. So you cannot really change it. And then from, I don't know, I think other panelists could say more about this since they have kind of really the experience with clinical trials. From our discussions, one problem was that it's harder to recruit women because they might actually be pregnant, or they might want to become pregnant and may not be able to become pregnant if there is a side effect that you don't know of yet. So there is a bigger risk, and this could have an effect in the participation. But I think, yeah, there's some others in the panel that could
For
say more
sure.
about this. No.
Yeah, Danielle, I'd love to hear your thoughts on this.
Yeah, absolutely. I see kind of 2 points where it gets difficult to involve women. So one is when you're sitting in the room and the doctor is thinking about what's going to be the next step for this patient. One of the disparities we see is who's offered a trial. So that you're kind of leaning on the oncologist, care team, cancer nurse to help the patient know about this trial. What Jennifer mentioned about more conversations now happening with patients, that's going to be super important so they can become their own advocates and kind of push for this. But that's a point where we can let bias sneak in. And that's where I think there's so much potential with technology, because if we can use data-driven approaches or systematically look at who's a candidate for a trial versus kind of who is offered because either someone remembered or they think they would be interested, et cetera. There's kind of a lot of decision making that would have to go through a person, and people are biased. So that's, I think, one point that's really interesting to observe and see how we can do better there. And the second piece is just making it easier to participate. So we work directly with patients who are interested in trials or just kind of curious, and we help them understand what that means and then find the right trial. And a lot of the concerns they have, especially from the women's side, is just things like, I have 3 kids at home and one of my son is autistic. I can't just spend a week in a hospital. My husband doesn't have all that time off. So a lot of the discussions happening now, and I'm super interested to hear from the rest of the panel too on this, has been on reimbursement and cost coverage. So beyond just reimbursing a parking ticket, can we help support women with childcare? Can we do other things like perhaps shifting more services to be virtual, so that way you don't have to lose that time traveling? And as much as, you know, we've talked or heard a lot about the promise of telehealth, virtual services, it hasn't quite come to fruition yet. There's a lot of kind of question marks in the logistics of it. And I think that's a piece that has a ton of potential, but not quite realized yet. And then what we have competing is we've heard stories from patients where the hospital's KPIs are now to increase traffic flow. So they have to go get their labs first and then come back in for an infusion. So they separate out the visits so they can increase the flow coming through. And then for the patient, she'd rather just travel once, spend that day and go back home rather than fight traffic 2 days to be able to do things like that. So there's so much in the logistics of how we set up trials as well that can really help kind of open up participation. And that those two things I think are super interesting for us to explore going forward.
And Lorena, what do you think about, because you come from a computational biology, bioinformatics. Is there anything exciting happening in the biomarker research field that could help with this problem?
I mean, I have to say that my experience is that normally we have to compromise a little bit the results in the sense of we don't have maybe enough data points to make sure that we can divide or give a precise message about this works better in men or women, or what is normally the common reason is that you don't know why. So it complicates a lot the process because the system is in a way that, you need to be very sure that it's safe and secure and it works. But all these rules that we have to make that happening is I think, this is my personal opinion, is preventing us to move a little bit forward in the sense that I think that we can agree that something is not gonna work equally for everybody. So I'm not saying that you need to get 1 million data points to make sure that you give the person what you need, but I think that it could be maybe some change in the system so transparency is better. And it's fine to give a result saying this worked 80% more in women. It could be either way, or men, and 20% in the other, or in this population, without being penalized in a business way. And more creating opportunity to be better. So we have some results that can lead to say that there is difference, but we are kind of, we need to hold back because we cannot explain the full story. At the same time, because internally you see that leadership is trying to take a step and say, okay, let's try to, for the big groups, let's try to get more people in this group so we can maybe say something else. So it's happening. But I think that we need some support maybe from the system as well. So it encourages companies to make the changes in that direction.
And Ryan, you come from a tech world. And, this is, we've seen it with Apple, Google, and of course, IBM. Everybody wants a piece of the cake, I suppose, if that's the right way of putting it. Do you have any opinions in this topic with drug development and clinical trials?
I would almost repeat what's been said by all of the other panelists. There's almost a system-wide transformation that is in progress. I think from the moment of inception, from identifying an opportunity that is gender specific, whether that's MS or conditions that are preferentially impacting women, through the development of those products and capabilities, and including things like childcare in the development programs, to identifying biomarkers that are preferentially specific to women. All of these things are critical parts of creating healthcare and drug development infrastructure that is not just more inclusive, but also ultimately more effective. I believe truly these conversations are beginning to happen. I think the depth and specificity of the conversation has a long way to go, but I also believe that leadership is hearing the message and recognizing that there is value in this level of diversity and the specificity it can bring to commercializing drug products. So long way to go, but I do think the good work has begun.
Excellent. Thank you so much. We've spoken a lot about patients, so I think that's where I'd like to take this discussion next, is that innovation within especially new type of technologies like femtech has highlighted the need of integration of real life patient data to be able to better create products, but it's not restricted to women's health. In the past, we've spoken about autistic patients, as well patients from sub-minority groups. How important is it for health tech companies to have diverse data points to include all groups within innovation, and how can they go about doing this? I will start with Ryan.
Thanks. And this really is a topic near and dear to my heart. There have been a number of examples over the last few years of companies developing and deploying health technologies, leveraging biased data and failing to recognize the inherent bias in those data sets, and then delivering technologies to the marketplace that are inherently flawed, and in some cases, embarrassingly so. And when, the world looks back and does an embarrassing retrospective on how did we get here, a core sort of cause is often a lack of diversity in the development team, a lack of diversity in the team that brought it to the marketplace, a failure to appreciate the social or personal context of the ultimate end users of the products or services that are being deployed. And the result can be anywhere from embarrassing to potentially catastrophic. So anyone with access to Google can look up, failures in AI due to gender bias or bias in diversity and inclusion, and the examples are endless. But again, I think there is now beginning to be a recognition that that's not a viable path, option to go forward. And you're seeing companies like the company I work for, IBM, make diversity and inclusion a focus in their recruiting processes, in their promotion processes, in their talent management processes, in their executive leadership, specifically because that perspective, that diversity and perspective has meaningful ramifications on the viability of the products that are being put into the marketplace. So I think this is vitally important to the success of technology in healthcare. And I think it's beginning to change, but I still also believe there's a lot of work to be done.
Yeah, you've got something to add to that?
Yeah, so I would ask the question, what does diversity mean? Does diversity, could a team full of men also be diverse? Does it have to be men versus women, or can it be generally diverse? The example of Microsoft, that they started putting out a product that is faulty. Up to today, their product is faulty. It doesn't change, and it's not particularly femtech. So I think there are different ways of doing business and going about a product launch, saying, okay, we're pragmatic, it's not going to be perfect. And then the end user is, however, expecting something perfect. So first question, what is diversity? And the second question is, are we as end users not always expecting too much from technology that is not doable, that is not realistically possible? Yeah.
Danielle, would you have anything to add to that?
Yeah, sure. I think I'll put a quick answer on the question, Sophia, and I'll let everyone else also jump in. But I mean, for me, there is certainly always a diversity of experiences and skill sets, even within, let's just say, men or women. That's important. I do think we don't have diversity if it is without considering the diversity of biological sex or gender. I still think that's so important, and it's come up in various ways. There's great books about how we've kind of failed to design with this inclusionary perspective, and that's just on biological sex. And what came up with were things like police body armor that wasn't made for women with breasts. So they were actually too short, and there were injuries because of that, because they weren't protected. The crash bags that weren't really designed for the female stature. Even thermostats in offices. Anyone working in a US office knows how freaking cold it is, and that's made based on metabolic resting rates for men. So there's so many things that in small ways you could think, oh, there might have been diversity in a different way, but that basic, that at least division in a way, or just having men in the room, I would hope that maybe if we had a little more diversity in the groups designing those things, the question would have been raised, or it would have been tested. We could have brought in that diversity of perspective. And on the healthcare side, kind of recent, an example of where, that diversity is really critical is UC San Diego came up with a genetic score to predict prostate cancer risk. And they didn't include a representative population. And the score actually did not work that well on people with African ancestry. European ancestry, fantastic, African not, and they realized why. They had kind of a biased training data set and went back and corrected it. But that has such huge implications if we don't have that diversity. I mean, that's of course a very much data tech kind of discussion. But I think in general that diversity of teams brings kind of that creativity, brings different ways of thinking that can make products better. So I think it's just a huge advantage.
Absolutely. Lorena? We can't hear you.
Sorry. So just a quick note is that under my experience, actually what fails more is even the woman-man ratio can be a little bit biased or a lot, but what always I get is 90% of white people. And it's fine, but there are some cases that are disease that is known, like known that it will be different for some from people from other races. That for me, that is a little bit, that is kind of is on our side. It's like you are as a company, you are targeting whatever disease that is known that is different between maybe 2-3 population, then try to get those population. And I know it's hard. Everything is hard. I mean, we are not here just because it's easy, but I think that we always need to push ourselves to make a little bit better. If you are getting 5%, well, try to get 15. I'm not saying try to get the perfect, but I think that this happens normally in the communication with the doctors in the hospital, that maybe it's difficult to get that, but that is something that when we know is important, we should really try to make us accountable for that, because we know. It's not like, oh, we didn't know or whatever. So that is something that I will put on our side. For these cases, there is information. I'm not saying that, oh, you go to precision medicine at human level, like person level, but there are some cases we can do better without being perfect.
Jennifer, any thoughts to add to this?
I've got a few. I mean, I live, eat, and breathe real world data all day long. And, hearing the different comments, the largest investment in population-based clinical and genomic data is FinGen and UK Biobank. And it wildly overrepresents people of Western European ancestry. And these are many millions of investments in the leading pharma that are doing drug discovery across their pipelines. And they're starting out with data that's not representative of a global population. Now, in some research, having a homogeneous patient population is actually really helpful. But when you're talking about training a data set or training an AI on a data set, your input data very much defines how good your algorithm will operate, such as what Lorena was saying. And if you don't have access to representative data that represents the global population, it's never going to be trained for that. You're never going to notice those differences. And, I'm thankful that I'm in a position where I can actually directly impact that with who we partner with and how we help make data available and have representative patient populations. That's something that I love about the work that I do every day. Then there's a second part of it, and it's so basic, but it's listening. And if you think about how the data gets into the medical record, a patient speaks and a doctor listens, and that doctor then transcribes it into the medical notes. Now, I happen to be a weirdo and read through, like, my medical record is from my old CRA days, right? I was a monitor. I'm all about reading exactly what's in my radiology reports and whatever. And I found so many mistakes over the years of things that haven't been transcribed properly and really weren't listened to appropriately. If I think about my daughter who has a number of challenging health conditions, and I've done the same for her, and I have found many errors based on listening. This is the very data that, when permission is granted, is used to train these data sets. And if you don't have physicians that really listen and listen without bias and really start to understand the patient's experience, then you have a filter in the input. You don't actually get pure information. And it's fascinating. Probably about 15 years ago, there was a start in greater emphasis in patient-reported outcomes. What is the patient saying? And you can actually see in clinical trials things that the patient reports. I have a headache, I feel fatigue, I have joint pain, right? That's not measurable. There's no lab test, it's fully the patient experience. And what you actually see is women, or especially women of color, those symptoms, that personal experience is decreased. It's dismissed, it doesn't exist. They're just complaining, their pain isn't real. And when you talk about these data sets and where they come out, you're starting with an inherent bias. And when you talk about diseases that primarily affect women, like autoimmunity, which is very near and dear to my heart, you have a situation where more women than men are affected by autoimmunity. There's something very different biologically in women's immune systems. And the very things that you use to diagnose autoimmunity, which is super complex, are based on experience, and they're minimized. And then this is going into the training data sets, and this is being used for drug discovery. You can see that it really goes back to very basic listening and trusting someone's experience and how they experience the world, and just truly trying to take that in as best as one can without bias. And it's something so simple, but it literally is affecting the world and will affect the future of healthcare because some people don't listen well.
Thank you so much for that.
If you'll let me, I would love to
for sure.
applaud everything that you just said, Jennifer. It's absolutely spot on, and I truly was moved by what you just said. What I wanted to add was everyone on this panel, and certainly anyone that's participating, we all feel as though we have a responsibility to bring those perspectives to conversations around whatever sort of tech development, drug development it might be. That diversity and perspective can and often will have meaningful ramifications on the outcome of the product, whether that be tech product or drug product that you may be collaborating and developing. And even if it's something as small as, I had a headache when I took this drug, or something as large as, I can't possibly do this because I've got kids at home and I can't manage the trial with my kids, sets a light off in someone's head that says we're not doing this the right way. And that is part of the transformation that needs to happen. So bringing your voice to the conversation when you're invited to the table, and I know sometimes getting to the table is half the battle, if not more, but bringing your voice to those conversations is of vital importance to the success of, without overstating, the success of humanity, the technology's impact on humanity. So thank you, Jennifer. I was really appreciate what you said.
Absolutely. That was really, really good. Thank you so much, all of you. So I think, part of the reason that, for me, I'm the sort of person who likes to delve into the reason behind why things happen. I studied psychology, so for me, everything is about the root cause. And I know sometimes you can't get there, but the next topic that I want to talk about, and this will be the final one, because I'm quite conscious of the time, is that unconscious biases, which are the underlying attitudes and stereotypes that people unconsciously attribute to another person or group of people that affect their understanding and engagement with these groups. It has been shown that this unconscious bias, if unchecked, ends up within AI. And furthermore, Women in Global Health Organization recently stated that to ensure gender bias is not built within the fabric of AI, tech companies must deliberately include women perspectives at all stages of development. And yet women are grossly misrepresented within leadership and tech roles. What are some of the problems that can arise if these perspectives are not accounted for? And how can we ensure we're hiring, promoting, investing in women and other genders? I will start with Danielle.
Oof, okay. Big topic. Okay, so I think I'll start with maybe some of the bias, or how do we start to correct it? The trends, yeah, we're not still quite there. And maybe I'll just share a few examples, kind of my journey, and I think they represent others as I've met with other women in tech and things that we've heard or experienced. But I mean, things like, you've all probably heard of the quota. Everyone knows we're trying to hire women. When I first started, I was told I was hired because of the quota. And if anyone worked in consulting or other types of jobs, it doesn't really put you on a good foot. And it's really difficult to get projects, and you have to start by really trying to prove yourself, and you start at a disadvantage in a way. And other colleagues had interest in immediate trust, brought on projects, and I really had I'd say like a year battle to demonstrate that I was really there, because I should be there. And granted, I don't know if I was a quota hire. I've been trying to figure that out, but it's okay. It worked out. So there's still quite a few things there, but I mean, I've even seen like a lot of the spaces that we have haven't been super friendly for women. I used to work in war rooms. I don't know if anyone worked in those back in the day. Very uncomfortable. 14 hours in a room with someone. Yeah, God, yeah, not pretty. I mean, things like that, you're just like, is this really building inclusive environments? I don't know. I mean, other thing, my co-founder and colleague, she had 2 kids, and she was breastfeeding as we were kind of traveling and going to conferences. It was just appalling how difficult it was to find places to pump in one conference. They put her in a closet, and I tried to give her my phone so she could have a little bit of a light, so she wasn't just in the dark trying to pump, and then figuring out where to like bring the milk. It was just, it was really, really a story and a half. So I think, and Melinda Gates actually at the Forbes Women Summit, really earlier this year, talked about like, how do we get more diversity in tech and make it more inclusive? And her kind of call to action was, we need to actually start really early in the pipeline. We need to start even at the point of education and bringing women in at that point, and other genders. And I was actually meeting with a woman who is in Switzerland, very high up on a technical side. She said when she was learning about careers, they had women on one side to learn about being nurses, and men on the other to learn about engineering and computer science. And she had to get up and walk over. She said, no, I like computers. I want to learn this. But there's little things like that where it takes someone take a few extra steps to get there. And I think we need to take all of those away so we can really open up the playing field. And it's so important. And I mean, the biases, I think we're all seeing some of the news reports come out, like with Amazon's AI recruiting tool, biased against women. I mean, there's just so many things that can go wrong. So we really do have to tackle it, and we have to tackle it now. But like I said, the conversations like this are so important for us to work on that, to help make things a little bit better. And some things are just, how do we get more women? I've talked to a few groups about this. It's kind of like, just change where you look. Like, we may be coming from different backgrounds and experiences, One woman that I was coaching, she had been doing analytics. Her background was more general finance, but she was building Tableau reports, building Alteryx data flows, all these kinds of things. And I was like, damn, you're doing business intelligence. And she had put herself down as just being like a financial analyst. I was like, no, you need to go after these technical roles. Like you're doing things, like even though you haven't formally studied tech, and just kind of like building up and helping people get to those positions. So I think all of us here are obviously working on that. That's just my quick 2 cents.
Yeah, definitely need more female mentors for sure. And Lorena, I know that you yourself have experienced, I suppose, difficulties in getting to that leadership level, and you have a strong opinion on this. So I'd love to hear your thoughts.
Yeah, I think that when I think about this, my assumption, and this is maybe very, sounds very statistical mindset, but my assumption is that every person given the same opportunity could do the job that is the best for that person. So for me, in a population where you have 50% women, 50% men, in a equality system or ideal system that will never will get there in the next few years, but you should be able to see the representation of your population at every level if we are focusing the job and career. That is not the case. For me, that can happen in 3 points. Or women don't get into careers like when in the education part, universities that are more maybe in technology or computer science or any other similar one, or they get there, we are improving that, but then they start a job there. And as well, we are improving kind of the starting point, so the junior people, but then they drop. Or if they don't drop, then they never get to go more than be maybe an intermediate level in their career. So I think what is happening is that we are doing a good job, or trying to do a good job in the first 2 steps, where, hey, it's cool for a girl to be an engineer. We are improving as well. Okay, give a job to a woman, an engineer. It's fine. But we are a little bit stuck on the career path. And I really think that, as you were saying, psychology here, I have found, because I'm very involved in trying to get to the point that all my colleagues, that there are many women and men colleagues, normally I see men more going into this leadership position. And to be honest, I can see how we are different. I think that we are different because of how we grow society, but I see how woman is like, no, I cannot say that I'm good at this until you master it. Like, you have to be the best of the best to say that, oh, I'm an expert in this programming language. And on the other hand, in average, you get men, like, I have worked enough. I should be good. I mean, when I work, I will be better, and blah, blah. So I would say that this as well on us, but you need awareness for that. And you need to be, don't feel ashamed. I mind like that. I fight every day to say, no, I have been working on this 13 years. Every challenge that I have, I was able to overcome. I will do the same with the next one, because yeah, I scare every time that I have to go to a higher level, but I know that I'm going to be good. So, but in general, is that what I found? Like we, and I'm saying women, men, because we are discussing that, but we approach these challenges differently. So we need everybody. I guess that we need to, it will be good being aware of that, because then you can normalize. Like, you can normalize when a woman says that, then it's like, oh, maybe she is good enough, and maybe it's on your responsibility on your side to give the opportunity. I mean, to be honest, I'm head of Combio now, the second in whole Cambridge woman, because I got a good leader who say, okay, you can do it. But I found 15 that say, no, you cannot do it, right? So I think that is a question of, on the woman's side, to be aware that for now, we approach things differently, and as well in the leadership position, to normalize the experience of people, to really understand who will be good at a level, and not only look at the CV or what the person says and say, oh, this person comes from Caltech and has all this work and it will be the best. Maybe not. Maybe you really need other skills. So my goal here in all the work that I try to do is to bring that awareness and to try to make sure women have a higher confidence in their career, because that is a first step that needs to happen beside any other thing. But this, again, more in computational biology, I don't know if it's the same in others, but this is what I see have seen in the last years.
Sophia, you come from a traditionally male-dominated, discipline such as physics. What has been your experience, if you'd like to share with us?
Yeah, my experience was really that it depends very much on your internal self. I wouldn't personally want to say that all women are the same. I know a lot of female CEOs that are extremely confident, and doesn't have to be a CEO actually, but in leadership roles. Then if you think of small companies that we usually don't mention, like the hairdresser, like a restaurant, a lot of women actually lead a company or lead kind of our hairdresser, have like a restaurant with a lot of people under them, and no one would ever question or wonder about them. They would just do their job and they wouldn't discuss about it. They would just do it. And I've gotten to know a lot of women of those of this kind, of this, with this attitude. And I think that that this is this is the best way to go about it, to do what you believe is right, to do what you feel is right. And if you're true to yourself, then you will also get to where you want to be. And it doesn't have to be a leadership role. I don't think that everyone is made to be a leader. Not every man, not every woman, and it's okay. And I also believe that there are a lot of people who have insecurities, or if you think of the example of very tall people, no door is made for tall people. The buses, you always bang your head. And you could say, why is no one really taking care of my problem? And I want to mention this example because we're focusing tonight on the topic of women, but there are a lot of other topics, and everyone has, from my personal perspective, the duty to get over some of the issues that we have growing up, that maybe our parents tell us, you're small, you're, I don't know, you have too bright hair, too dark hair, you're too big, whatever. We have to get away from this, and this is our challenge for our life. And this is independent of whether we're a woman, man, whether we have a different sex, whether we're black, white, green, yellow, whether we have long hair, short hair, whoever it is. Yeah. That's my perspective on that.
I'm very aware of the time. So maybe very, very quickly, if I could have Jen and then Ryan to have just your opinions on this topic, and then we'll go into the breakout rooms.
Sure. So what was really coming to mind when we were talking about it is all of the people that have opened doors for me in my career, and how I choose to pass that on and keep opening doors for others. And it's not just professionally, but I also think personally with my family encouraging me as a young woman, very interested in science, that's awesome. You know, there was never anything else from that, to my husband, who I swear is the reason I eat most days, because otherwise I would starve to death, to so many mentors in my career that really saw it as part of their responsibility professionally to be opening doors, to be making room for that seat at the table. And how do we continue to pass that on? And how do we continue to support that in hearing everyone's voice and encouraging that? And, you know, I think about the team that I lead, they are amazing. I am so lucky to have the team that I have. But I was kind of trying to count through my head, and I think we're pretty close to 50-50 in terms of gender representation, which is almost unheard of in tech. But we've never had a problem recruiting women. It's been something that's been very natural for us to, when we think about complementarity and representation, that we are able to do that in regular non-creative recruiting methods. And so really that appreciation for what's happened in my career, and further the commitment to keep giving back to others.
It's amazing.
I would again echo what Jennifer said, and said well. Look for allies, look for people that are actively looking for opportunities to help you advance. I can tell you nearly every team I've managed, and again, I have led business and data and analytic business units now at several companies, have been 50-50 gender splits. And I still make mistakes. And I genuinely, 3 days ago, posed a question to my leadership team that is 50% men and 50% women. And 5 minutes after the call ended, one of the women on my team said, "You really didn't handle that the right way." And we felt uncomfortable. And I apologized, of course, but I also, thanked her for bringing it to my attention. The bias exists, and we live in a world where that bias is now ingrained in hierarchies in large organizations, and certainly in tech organizations. I would say look for your allies and people that, at least in my case, try to be aware that we're not always going to get it right, but doing our best to course correct when we get it wrong is part of making things better. So thank you to all the other panelists for including me in the conversation.
It indeed has been a very, very good discussion. Thank you so much, Ryan. And that's it from us. Thank you so much for sharing your time with us. And thank you to our speakers for sharing your insights. I hope you can join us for our next webinar, which will be a Pride special. More details will be available on the Meetup website and also for the confirmed date. So stay tuned for that. And for those who wish to continue the discussion, there will be a breakout room where we'll be meeting everybody. So I'll leave you with this last poll here. How do we ensure there is gender balance within data and technology? Do we create more awareness, empower others, mentorship, training on unconscious bias, childcare, elderly care, paid leave programs, more women in leadership, and accessibility? Thank you very much.
Thank you.
Thank you. Bye-bye.
Yeah. Bye.
Thank you.